Hello, good morning. This is Dr. Gayatri Deshpande, Head of the Department from Nanavati Max Super Speciality Hospital, Mumbai. I would like to share some important information for the expecting parents. As you know, each and every baby is extremely precious, particularly when it is planned after a long time, as well as when the pregnancy age of the mother is little more than the normal. On an average, the women plan their pregnancies after the age of 30 now. With this advancing age, we must remember the risk of the having chromosomal abnormalities, that is trisomy 21, which is called Down syndrome in our normal language, as well as trisomy 18 and 13 are really increasing with the risk of the maternal age. So is there any test by which you can actually detect the possibility of having the problem with this pregnancy? The modern technology says there is definitely an answer. You will be surprised and happy to know that there are non-invasive tests available, which is just a sonography at around 12 to 13 weeks of pregnancy, along with a blood test where the maternal blood is drawn for the values like PAPE as well as free HCG. Whenever these two tests are combined, they actually determine the risk of the present pregnancy having the chromosomal problems of Down syndrome. The sensitivity and the specificity of the test is quite good, and it actually makes a marker whether this pregnancy can be safely continued. In spite of all these things, in case your pregnancy happens to be a high risk, there are further investigations available for a confirmatory diagnosis. With the modern technology, now another marker which is available is your risk of developing hypertension in your pregnancy as well as the growth restriction of the baby. So I would always recommend and request all the expecting mothers to go ahead for the dual marker and NT test, along with the risk factor for the PIH, that is pregnancy induced hypertension, and the growth restriction of the baby. So ask your obstetrician for these tests today. Thank you.